Disclaimer: the content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. And now...
Yeah, we don't want to do anything to scare your children. That's the last thing we want to do. We don't want to scare anybody.
Ladies and gentlemen, please welcome Ben and Amy on The Heavy Truth.
Hello, Heavy Truth listeners.
Hi, guys. Welcome back.
This is Amy.
This is Ben as well.
Happy New Year.
Yeah, Happy New Year. I can't believe it's 2024 already.
Definitely goes by fast.
It flies by, right? When you're having fun. Did you have a good New Year's?
It was very fun.
Good.
Uneventful.
Yeah.
Quiet, but that's okay.
Good.
You?
Yes, we had a good time. Like we had said last episode, went bowling with the gays. We had a good time.
Had a ball dropping?
Had a ball dropping, right? Exactly. Yeah, we had a good time. And here we are in January.
That's right. Here we are in January, and we know that hot topic that has been circulating all over social media.
The GLP-1 craze, right? Everyone is seeing it all over social media, right? The injectable medication to lose weight, and it's like having had bariatric surgery, and you know, just
all the celebrities coming out of the woodwork admitting to having it prescribed to them and taking it, and you know, it definitely is probably, I'd say, a good 50% of my patients.
Oh, same, yeah.
You know.
And they all have that question coming into the clinic on the new consults and things like that, you know. But I think that's on everybody's mind because you see it everywhere, right? It's on every social media thing out there, right? And everyone makes it look like it's just a miracle pill, a miracle shot.
And easy to get.
And you lose all this weight. You don't have to do anything with it. And it's so, you know, no problems whatsoever, you know. But look at these crazy side effects.
Yep.
You know,
right. The good, bad, and indifferent with these meds, you know, is really what we want to uncover here and explain what they are and how.
From our perspective.
From our, absolutely. Are they easy to get? Are they difficult to get? You know, in reality, what are the side effects associated with them? What are the risks? What could someone expect to lose being on these medications? You know, and so forth. So we wanted to at least give a little bit of a background as far as what these medications are and how they affect our body and how they actually work. So, you know, these are an injectable medication, you know, like you said, and
there are a few that are oral.
Yeah,
but the ones right now that you see out there that everyone's wanting.
And that is going to be nice, too, though, when there are some tablet forms of these medications, because that is a barrier for some patients. They don't want to do the injectable. You know, they're afraid of it.
You know, and these meds were originally designed to help with blood sugar control and you know, in type 2 diabetics, right? And so that's one of the first things I always tell people who want to come in, right? These medications were originally designed for diabetics to help with blood sugar control. And then they noticed, right, these companies that manufacture these medications, that there was a significant amount of weight loss behind it.
With their trials.
Associated with the trials, correct. You know, and so, you know, that's where it all began with some of these companies is helping to control, you know, blood sugar.
Yeah, right. So glucagon is a hormone that is produced by the pancreas, and it helps us regulate our blood sugar levels. Right. So it works by signaling the liver to convert stored glycogen to glucose.
Right.
So we get back to this, you know, has the relationship between blood sugar and such, and this is why. So, you know, when glucose, it's released into the bloodstream, that's how we have high blood sugars. Glucagon secretion is then stimulated by low blood sugar levels and inhibited by blood sugar levels being high. Right. So when they're higher, this whole process ultimately when you have a lot of insulin, then you can have stored fat. So,
And insulin is produced by, to help lower that blood sugar. Pancreas produces that, right?
so when blood sugar levels are low, glucagon is secreted to stimulate the liver to release the glucose into the bloodstream, which then it'll raise those levels up. But we do know that glucagon has been found to play a role in weight loss.
Yeah, there are many studies that feature, like Journal of Comparative Psychological Psychology, that rats, when they received, when I was looking at this, glucagon, lost body fat. And so then when these rats received the insulin, they would gain, the body fat back. So we've been to presentation where we say, insulin is a weight gaining drug, right? People often will have difficulty losing weight if they're on insulin, right? And then in diabetes, your blood sugars go up more, then they're putting on you more insulin, you're gaining more weight. It's like a vicious cycle.
Absolutely. So we have these GLP receptors in our intestinal tract, and that's where you get the GLP-1 name. It's a glucagon-like peptide. So that's one of the hormones that are associated with these medications. Later on, we'll talk about the GIP as well. That's some of the newer medications. But really what happens is they work by mimicking the same effect as the GLP-1s in our body.
Right.
And it just helps regulate blood sugar levels. And in essence, you have a benefit of
weight
better,
loss.
and better blood sugar.
Better blood sugar control, better A1C, and then people behind that, right? Then they've noticed that there was weight loss tendencies behind it, right? Now, then when they started to realize that, many of these companies started to then rebrand the medications so they could use them also for weight loss. And that's where it comes into many of these things that people see out in the market saying, come here, come here, come here. This is what we can give you. This is what we have. This is what we can buy. And, you and I both know they are very expensive medications, if not covered by insurance. Thousands of dollars these injectables cost out of pocket if no insurance coverage, right? And unfortunately, as a society, we don't recognize obesity as a chronic disease as we should, right? So many of these insurance companies or employers choosing insurances are opting out of things like weight loss medication coverage, right? And what people don't realize that is it's not the insurance company entirely making that decision, right? It's your employer checking that box saying we're going to opt in or out of
it's
being
the
able to
plan
get
they're
these,
choosing.
the plan they're choosing to get these medications, and that's where sometimes the not just the individual, but the provider who is prescribing these medications doesn't know, I shouldn't say doesn't know, but isn't as knowledgeable about the use of these medications or the names of these medications as someone who does obesity medicine or does it as a specialty or is more versed, right?
Yeah, you're saying primary or something, right?
Primary care providers, right? And no offense, they're very busy. They're dealing with X, Y, and Z for these 30-minute visits where they're covering everything. Where they're not
15 minutes,
15
if they're
minutes.
lucky, probably.
Yeah, the ones we talked to said that, right? We were recently, Amy and I were recently in San Antonio for an obesity medicine conference, and some of the primary care providers sitting at a table said that 15-minute visits,
10 to 15-minute visits.
They couldn't touch on all the topics, right? You got to talk about, if they have hypertension, all these other things, and it's harder for them to deal with the obesity meds, right? And so they come to see, special people that specialize, like you and I, in obesity medicine. And then they realize that the doctor, nurse practitioner, whoever their primary care, sends them to see us thinking they could be on all these weight loss medications, but calling them by different names, right?
Right. I came to see you because my doctor said that I could get Ozempic.
Right. That's the biggest thing, right? Ozempic. Everybody sees it all over the marketplace, everywhere. Oh, I'm on Ozempic, 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 Ozempic. The truth behind it is, you can get Ozempic, but 99.9% of people on Ozempic or trying to get it covered by their insurance have to be type 2 diabetics, right? And it has to be proven.
Right.
You otherwise, Ozempic costs well over $1,000 a month if you want to pay for it out of pocket. You know, and so, but it is geared towards diabetics. You know, another one is, I know people have seen it all over, is the tirzepatide or Mounjaro, right? Because that's a big thing, right? That's new. Mounjaro's other medication geared for weight loss, which is now called Zepbound, right? That is specifically geared for
It's
obesity.
indicated for obesity.
Indicated for obesity, right?
Mounjaro for diabetes.
Mounjaro for diabetes. So I think that's the biggest thing, is that people are not realizing what medication is for what. Or when they call their insurance company, they say,
Is Mounjaro covered?
Or when usually, yeah, right. Is Mounjaro covered? And they say yes, but they're not asking, do I have to be a diabetic, right? Because
Yeah, they don't know the questions they ask.
they don't know the question. Yes, or they're saying something like, is semaglutide covered? Well, yes, that would be Ozempic, not necessarily Wegovy, which is also semaglutide. So I think it's hard for people to differentiate between the two, and many providers don't realize, and so they'll send these scripts in and it's denied, and they're like, well, I don't understand why my Ozempic wasn't covered. Well, you're not a type 2 diabetic, you know?
And that's why it's important to go see a specialist, right? And,
Right.
you know, I kudos to all the primary care out there, because I couldn't do
Absolutely.
it. You know, I'm a family nurse practitioner, but I always knew that I wanted to specialize, you know, in something, you know, and it always was geared towards endocrinology, obesity, something like that. And because I could never do like 10, 15-minute visits, and you just don't have the time to touch on these things. And fortunately, you know, for us in a specialty, we do have a lot more time than primary to deal with
Right.
these things. And we have the staff to help with these medication approvals and prior authorizations
Right.
and things, which they don't have either. So, you know, keep sending them to us, because, you know, we definitely have more time and we can get things covered just by putting things in our notes, you know.
That we know what we're looking for,
Right.
For very specific reasons. Just like if we, you go on to see your primary care provider, but then you're having a cardiac issue, you know, they send you on to cardiology, they send you on to endocrine for diabetes, things like that. So yeah, again, I agree with you. Kudos to the primary care providers. We thank you from the bottom of our hearts, because we know that you are that first stop, right? And there's so much that you have to deal with. And I had heard while I was, I had learned while I was training, again, as a family nurse practitioner like you, and then working with obesity medicine, that obesity is the hardest topic to talk to a person about. And so many of the people that do come to see me or that I know will say, well, they just sent me here and didn't tell me, because they really don't talk about it. But again, they come under the guise that coming to weight management or an obesity clinic or something like that. And there are some of those clinics out there where you walk out the door with a medication, right? But I don't think there's a lot of education behind that with some of those, you know? You see all over the internet things like, oh, people are having all of these side effects from these medications. And yeah, there are side effects, right? Because these medications do a lot of different things. So there are side effects to these medications, but I think the number one thing that you and I have both seen is that many people that are having these side effects are not doing any type of diet or lifestyle changes with these medications. They think they can just run out and still eat the wings and the beer and the pizza and the tacos and take my shot, take my pill, and I'm going to lose weight.
Right. And yeah, sure, they're going to lose weight, you know, and that's what I say too.
Sometimes.
I say, you know, I'm not going to prescribe medications if we're not going to start with lifestyle and, you know, making more improved and mindful choices to begin with, because not only are you not going to have long-term success, you are going to have severe side effects, which then is going to lead to noncompliance.
Yes.
So, you know, these medications, since they do work on the gut, you know, they slow down gastric motility, you know, can cause, lead to constipation, nausea, vomiting, diarrhea. But I'm telling you that if patients are following an improved dietary eating plan, and I don't say a diet, so dietary eating plan, my patients do very well, and they will do well. You really have to have that education behind it. And I remember, I mean, you'll laugh at this too, but I typically don't post much on social media myself. I'll just, I'll look through things but there was one comment that someone was saying something about, and this is like a provider, like Facebook group. And they were saying something about that they don't withhold any medication from, remember that one where you came to my defense?
Yes.
And they were, I never withhold, I give everyone medications, they walk in and, I give it to them. So, and then I just put in there.
Girl, they probably give everybody a Z-Pack that comes in with a sniffle for one day too.
Probably. But like I said, I typically never say anything, but I'm like,
and you know who you are, lady, on that Facebook group.
I'm like, I will give people medications if it's warranted. And, if they're showing that they're making progress, they're making improved choices. They're showing progress. I'm not saying they have to lose so many pounds before they go on meds. This lady attacked me. Like, how dare you? So I text Ben and I'm like, you gotta go on to the Facebook group. I'm like, I'm getting attacked here. He goes, all right, hold on. So we both, we're dying laughing. And he's like, all right, how did that comment come out? But, bottom line is we practice our own way. If somebody over here chooses to not, or to give meds right away, great.
If you want to pull up and talk in the clown head and pull forward to the first window and pay for the med and pick it up at the second window, girl, you do you.
Right, but I want to see where you are in 4 or 5 years,
But don't be shocked then when you're pulling over on the Oasis because you crapped your pants because you had a 12-piece chicken nugget and a side of large fries and you're wondering why.
Absolutely. Because these medications can have a tremendous impact.
Absolutely.
On your life.
I agree with you 100%, and I want to throw it out there. We never expect perfection. If I try to expect perfection, I'm on one of these weight loss medications. I'm very transparent about that. I'm on one of these weight loss medications. I had bariatric surgery. I was 425 pounds at one point. I am 220 today, and I couldn't tell you the last time I was. It's probably in high school, which was just a mere, 2 or 3 years ago for me in high school. Amy, years, 30 years for high school? But anyway, if I can honestly tell you, if I'm eating crap, and I say crap, when I say the word crap, I'm talking about, I've eaten some M&Ms, I'm eating some what I consider junk food. I can understand. I'll get the GI upset. I'll have some diarrhea.
High carb,
I'll feel
high carb stuff. Mm-hmm.
Right. Now, am I being perfect? No, but I can tell you, when I look at a month's worth of eating things that I'm tracking, I'm more consistent than inconsistent. And that's what I tell the patients and people that I work with is I never expect perfection with anything, but you have to have some sort of foundation with these medications or they don't work. Because I've seen patients, as probably have you, or people on Facebook, period, or on anywhere who are on these medications and it's doing zero for them because they're not changing or making the lifestyle changes that they need to make.
Yes. And then they'll say, well, I'm just a hypo responder. And I'm like, you are not a hypo responder. That is a real thing. It definitely can be, which means people don't respond to the medication. But there are also ones that haven't done anything, dietary change-wise. I mean, we can't continue to drink the soda and we can't continue, to, like you said, have the M&Ms and, have burgers and such, but just eat half of it. I don't want people eating less crap, as we say. I want them to be eating more healthy foods.
Yeah.
So they actually are feeling better. Overall, you are what you eat, honestly. So these medications are used as a tool to treat chronic obesity. It is a chronic medication. Don't let anyone ever tell you that you could be on it for 6 months and you don't have to be on it anymore. I do have some patients that have been off it, and they've gone off it for, multitude of reasons, whether it's insurance, whether somebody wanted to get pregnant, or insurance, stopped covering it. But it is indicated for chronic treatment.
Exactly. So that's what I always tell people, they don't take away a medication that's treating any other chronic disease. That's probably helping maintain your blood pressure at this point, maintain your blood sugar at this point, maintain whatever. Why as a society or as medical professionals, is it okay for them for insurance companies and for whoever to say, well, you get 6 months on this med and that's it. That's ridiculous because it's treating chronic obesity.
Right. And I think it's just a stigma too. People have it in their mind, well, I've lost 50 pounds, so I'm done, so now I'm going to go off the medication.
Well, that falls in line with those the people. And my grandmother was one of those people was a diabetic. And once her blood sugar was within normal range, she was no longer on anything. The doctor had taken her down because she was now called in her chart, and I see it, a diet-controlled diabetes. But in her mind, her diabetes was cured. She was no longer diabetic.
Right.
No, you're always going to be a diabetic. Right? You're just diet-controlled.
What about patients that come in and ask you for compounded medications?
I now personally, I take the stance, as does the holding a certification from the Obesity Medicine Association, and from my own background in obesity medicine, I am not a person that sends scripts for compounding meds. The compounded medications that many of these places you see out there giving, that you can get, these are compounded salts, right? They're not the actual medications from the manufacturers, because those medications are all
Under patent.
Right? So I am not the person that would send that for people. I always believe if that's what they choose to do, that's fine. But then that's the program they need to go to be at, right? Because many of those places, not all, because there are some that we see now that are working with diet and things like that, but many of those places are those, like we just said, pull up, talk to the clown head, pay at window 1 and pick it up at window 2. Right. So my stance is
Med spas, a lot of med spas.
Med spa. Yeah, like that. So my stance is I personally do not prescribe compounded medications. If the individual wants to do that, that's entirely up to them. Because don't get me wrong, I understand how expensive the medications are. I think it's crappy that insurance doesn't cover these medications, and that the employer can opt out of it. And I understand that people feel like they need to turn to an alternative, right? Would I do it if I was in that boat? I don't know.
Right.
I don't know. I can't tell you. I can tell you I probably would. But again, then I would be going to one of those clinics who are working with them, right? I wouldn't. I personally don't. What about you?
Yeah, no, I agree with you. Yeah.
And again, lifestyle still, there's supposed to be lifestyle changes there too.
Yeah, no, for sure. I mean, you and I, we practice very similarly. I agree. I don't fault anyone if they come in to me using them. I do try to get them on the actual product, the same brand name medications. But again, most of the time they're doing that because they don't have coverage, or for Medicare is not covered. That's something else
That's another thing, people. Medicare does not cover weight loss medications. Not at all.
Right.
So that's something that as organizations, we are lobbying in Madison, in Madison, right? Our state capital, in Illinois as well. And then also in Washington to have some of those things changed, because do they not think that people on Medicare deserve to have these medications?
Absolutely. And, once Medicare would get on board, it's going to change everything because we follow Medicare a lot with all of the things that we do. But, the thing is, there's cardiac benefit, with these GLP-1s too. And so this will benefit our 65 and over population, and they're a high rate of overweight and obesity. They're a good percentage of our patients. So that's the group of people that we need to really focus on too, because they just get heavier and more chronic illness and effects of weight. Then they develop other things. And I have a lot of patients on Medicare, and when they find out that I can't get anything for them, it's devastating.
It is devastating, yeah. And that, unfortunately, that's again where some of the primary care providers don't understand. They send them to me, and I'll read the notes, and the notes will say, sending to blah 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 for weight loss medication, and I have to explain to them the injectables which you're coming to asking for, because I asked for specifics, right? What they've seen on TV, and I have to explain to them that Ozempic is a diabetic medication. We won't be able to get it. X, Y, or Z is not covered by Medicare.
Yeah, and even now, I mean, with all of the shortages,
and let's be real, we can't get it anyway. Even if we wanted everybody to be on it, there's so much shortage, which people are not understanding.
No, they're not understanding. I think the last time I had any samples in, was probably May. I think all my samples have been gone since May, and they haven't been sampling them since the beginning of the year.
What we tell people is the shortage. So those of you that are listening, so some of the GLP-1s are titrated medications. You start off at a lower dose and you titrate up, sometimes weekly, sometimes monthly, depending on the medication. They're titrated up to 3, 4, 5 doses up to get to what they consider a therapeutic dose. I'm just going to throw some of these out there because, the manufacturers know that there's a shortage, right? So, for example, Wegovy, made by Novo Nordisk, a wonderful, wonderful company that makes many wonderful products, and we thank you for them. However, if you were trying to get Wegovy today, it is out there. It's in very short supply at the 3 lower doses, right? The 0.25, the 0.5, and the 1, which means you have to titrate up. Insurance companies make us titrate up before you can get to the 2 upper doses, which are considered therapeutic. So we can't start the medications, and they come in and they wait and wait and wait and wait.
Well, they're titrated because if we start them at the 0.1, they're going to be in the...
They're going to have these side effects, right?
They'll be on the toilet.
On the toilet, throwing up, not for holding foods down, right? And same thing with the other medication made by them, which is Saxenda, right? And so that, again, is in short supply. So... And we're not talking about short supply just in the U.S., right? We used to be able to send it to like Canadian pharmacies, the scripts, or like Amazon pharmacies, things like that to get them. They're in short supply. So these pharmacies may be able to get them, but there'll be 300 people on a waiting list for a 0.25, and they get 10 of them in, right? And that's it.
Yeah, and what they tell us is that they have shifted more production of the higher doses because they had so many people on the medications. So they want to make sure those people were able to continue staying on them. It sounds fairly reasonable, but at the same time, we haven't had any medications to start new patients on for months, Yeah. And then
now another thing that they're saying, so I want in their defense, is that they are opening new plants for production, right? But they could open the plants today. It still takes 6 to 8 months to get that product line up and running, right? So they were supposed to have opened new plants, right? The date kept pushing every time I talked to people, to my reps. Last September, October, blah, blah, blah. And girl, the plant's open. Where is it? Where's it coming?
Yeah. I don't foresee any supply improvements before Q2.
Yeah.
I don't. Maybe, but I guess we can be hopeful.
Do you think, I know we're coming close to our time. Do you want to continue this topic? I think it's a really good topic to continue for another one.
Yeah. I think we could, we can pause it. This is what we're going to do. We're going to,
you tell me, Amy, what are we going to do?
We're just going to highlight some of the important things that we discussed for this episode. Again, making sure patients know how difficult it is to obtain these medications.
Yeah.
Don't be going into a clinic, just a clinic setting expecting that you're going to be getting X, Y, and Z, because there's a lot behind that.
Right.
Other things that go into that.
If you want to find out, call your insurance company. Be very specific with names. Say stuff like, does my insurance cover? Don't say weight loss. Say anti-obesity medications. Yes or no? And if they say yes, then you have to say, because they'll say, oh yes, semaglutide. Then you say, do I have to be a type 2 diabetic? If they say no, then it is, or ask for things specifically. Wegovy, Saxenda, Zepbound. These are specific injectable weight loss medications that are anti-obesity medications. And that's what needs to be asked, right? It needs to be called for by name and say anti-obesity meds. Because the people answering the phones, and no offense to those people who work in insurance, are not weight loss specialists. They're not, usually not doctors or nurse practitioners or physician's assistants answering the phone saying yes or no, It's usually Peggy in Bombay. It's not even called Bombay anymore, but that tells you how long I know. Telling you what your insurance covers. So,
yeah, no, I think that's good. We'll continue with next episode from this topic, and again,
because I was long-winded and I just kept yapping. So realistically,
that's okay. That's all right. We'll regroup again. If there's any comments, questions, please let us know. Remember,
like the lady from their Facebook group, feel free to comment on that, ma'am.
Follow, share, like theheavytruth.net, Facebook,
TikTok, Instagram, all that jazz. Until next time, guys.
Take care.